It had always been in the back of my mind because 5 years ago my mom was diagnosed with breast cancer.
Danielle Ames had a family history of breast cancer. Still, her diagnosis at age 31 shocked her.
You don't hear about young people, 31-year-old people with cancer, with breast cancer. You think of it as older women.
The single mother's greatest fear?
That I was going to die and nobody was going to be around to take care of my kids.
I'm first a daughter of God. I have a very strong faith.
Lynn Holcomb had no family history, and then she felt a lump.
Dum-da-dum-dum. I kind of just knew. I knew what it was.
The diagnosis of breast cancer drilled into both Danielle and Lynn that as women, we are all at risk.
We do need to talk about is the borders of the breast.
Watson Clinic Dr. Elisabeth Dupont weighs in on the most significant risk factors for all of us.
I think it's diet and exercise. I really do. We're seeing that women really are having a postmenopausal weight gain that's very troubling, and I think it's contributed by our sedentary lifestyle and high fatty food diet.
Dupont says there are other risk factors that we can control. Waiting until you're 30 or older or not having children at all puts you at higher risk.
Breastfeeding is supposed to have some protective effect, but really I'm finding that not to hold up a lot. I have a patient who breastfed 13 children and she still got breast cancer.
But there are also risk factors that we simply can't control or change, like the age you start your menstrual cycle.
Younger than 12 tends to be a significant risk factor.
Women who start menopause at 60 or later have a greater risk as well.
All of this may be estrogen stimulation of the breast during this long time period, and we think that is significant.
Another risk factor that you can't control, family history. If you have a first-degree relative, a mother, a sister, a daughter, who has breast cancer under the age of 50, your risk goes up significantly.
If a man in your family has breast cancer, that's highly, highly, highly significant because that is very likely to be a genetic component.
Lynn's father died of colon cancer, and her sister was just diagnosed with breast cancer. Now she has a family history and fears for her 29-year-old daughter, who has yet to start a family of her own. Linda Hurtado, ABC Action News.
And Dr. Elisabeth Dupont and Lynn Holcomb join us live in our studio this afternoon. Thank you so much for coming in.
Thank you.
Linda's story really brings home the point that there are no guarantees, that all women need to be on the lookout for possible signs of breast cancer. For decades, doctors have talked about the importance of self-exams, self-breast exams. Why are they so important?
It's really important to know your breast because you're the one who's living with them and you're the one who will discover any change first. You live with yourself all the time and you maybe see a doctor once or twice a year.
Do you think that women have moved away from the self-breast exams in recent years?
I do. I think self-breast exams have gotten a little bit of a bum rap because it's an exam like college or high school and you're afraid to fail. And that's not the idea. The idea is that you have to be aware of your breast and practice self-breast awareness. That's right.
Lynn, you are living proof that the self-breast exam is critical. Tell us how you found your lump.
My husband and I had been doing a lot of physical activity in our yard, and I had noticed that I was having some breast tenderness. And then it was also time for my breast self-exam, and in the shower, I found a lump. And I think in reference to Dr. Dupont's statements, I think we lull ourselves into a false security with the mammograms. I think we're afraid to find something. I think that's the biggest problem. And it took me 3 days after I found it to call my physician and make an appointment because I just kept thinking, I'm not really feeling this, but I did.